But we are going to move on to our 9:06 a.m. item 6.2, consideration of a presentation by United Way of the Wine Country regarding possible expansion of 211 Lake County from disaster only to full service. And CAO Hutchinson.
Thank you, Mr. Chair. I want to thank Matthew Rothstein for taking the lead with this project, and he will introduce this item.
Good morning, board members. As you're aware, Lake County implemented disaster-only 211 service in 2019, and this was state-funded through SB 1212. Primarily, 211 has been used to provide information regarding COVID-19 and PSPS events in Lake County, and further resources are available at 211lake.org. The intent of the disaster-only program for unserved counties was for jurisdictions to build databases of services available in their communities and consider fully implementing 211. Nicolette Weinsweg, Lisa Carreño, and Jennifer O'Donnell of United Way of Wine Country have been working with us. And this morning, Ms. Weinsweg and Ms. Carreño are present to discuss what this would look like in Lake County. Today's presentation is informational only, but your board may wish to provide direction to staff. Welcome, Ms. Weinsweg and Ms. Carreño. Thank you very much for being here.
Thank you, Matthew, for inviting us to be here, and thank you, board members, for giving us the opportunity to speak with you today. I'm Lisa Carreño. I'm the president and CEO of United Way of the Wine Country. Briefly, I'll share with you that United Way of the Wine Country became the administrator of 211 Sonoma in the summer of 2019. We have, for the last 2.5 years, largely been operating 211 Sonoma with post-fire, fire emergency, public safety power outage, and then, of course, over 18 months of the pandemic. We have been working collaboratively with local partners, with the County of Sonoma, and with community-based organizations to build a very robust year-round program that gives access to our local community to all of the resources that can be experienced through the website, through text and phone technology. And we wanted to share what that model has looked like here and introduce the opportunity, invite you to work together to potentially build a similar model in Lake County. With that introduction, I'm going to turn the rest of the presentation over to Nicolette Weinsweg. She's our Vice President for Community Impact and oversees the 211 initiative. Nicolette, take it away. Nicolette, we can't hear you.
You're not muted in Zoom, but you might have your microphone turned off. No, still not.
No.
No?
Aha.
Okay, all right.
Thank you.
Technology issues this morning. Thank you so much, Lisa, and thank you to the board for having us here this morning. As Lisa mentioned, my name is Nicolette Weinsweg. I'm the Vice President of Community Impact at United Way. Wanted to just take a moment to briefly talk about who United Way of the Wine Country is and what 211 is. So United Way of the Wine Country has existed for over 50 years, and we work to support sustainable improvements to systems and services that benefit all people in our community. We proudly serve families and individuals living in Sonoma, Mendocino, Lake, Humboldt, and Del Norte counties, and are deeply committed to improving family financial stability, serving as a vital link between residents, nonprofit organizations, businesses, and government leaders. Our work is guided by the values of equity, inclusion, collaboration, integrity, accountability, and transparency. So 211, really the vision of 211 is to be the community's go-to resource when people require compassionate help navigating many resources in our community. We know that it's difficult to reach out for help, and so we really strive to be that compassionate and inclusive source of help for our community. 211 provides access to community health, social, and disaster services as a full service 211. Currently, Lake County's 211 is providing disaster only services, mainly around COVID. However, people can call 211 at this point and have access to some of the limited resources that are in the database, because we know that when people call for, COVID related information, whether it be vaccines or testing, that they may also be food insecure or have questions about housing. And so there are some resources currently in the Lake County 211 database. We serve as a trusted source for access to comprehensive information, referrals, and direct assistance. We operate 24 hours a day, 7 days a week, 365 days a year. It is a free service. It's available in up to 200 languages. And as you guys are now, and as we have been in Sonoma and Mendocino County, we play an important role in providing official incident-specific information in coordination with local emergency services in times of disaster. We contract our call center out to Interface Family and Children's Services. This is also the provider that is overseeing all of the disaster-only 211 services. So our call center that takes Sonoma and Mendocino calls at this point also takes Lake County calls. So we do have a relationship with them. We've had this contract with Interface since we started 211 in Sonoma County in 2019. And recently when we took over 211 in Mendocino County, we've also obviously contracted with Interface. So we work with Interface to curate information. We are kind of the boots on the ground in our local communities. We are the face of 211 Sonoma and Mendocino. We interface with the partners in our community and get the resources that go into the database, and then they are the ones that take the calls. We also are responsible for all of the marketing and fundraising for 211 Mendocino and Sonoma. And so just to touch briefly on how full service is different than disaster only. Disaster only 211s under SB 1212 are only activated during times of disaster. This is a very unique situation that we're in right now with COVID. Typically, I think that the thought behind this disaster only 211 is that we were seeing fires ravage California, and there wasn't a place that people could turn for information, that was an easy to remember number. People were putting out all these different numbers for CAL FIRE and for the county and for community-based organizations. And so when Disaster Only 211 was envisioned, it was envisioned to be activated during times of, fire, flood, earthquake. Now we have COVID, and COVID is obviously an emergency or a disaster. And so these SB 1212 disaster only 211s have been activated, and they are taking calls from community members and giving them information and referrals to vaccine appointments or testing sites, financial assistance, the ERAP program. And so Lake County currently has a limited database, although it is the largest database of all of the SB 1212 211. So that's a really wonderful thing that, there is housing and food services and mental health support and all of the services that people would need to access by being impacted by COVID. A full service 211 just expands on that. So there's additional resources in the database that aren't directly or somewhat related to the current disaster or emergency. And full service 211s also, in addition to having a comprehensive database of all of the health and human service referral organizations and information in the database, also do special projects. So in Sonoma County, we contract with the county to provide CalFresh eligibility screening and enrollments. We also do the scheduling for the VITA free tax preparation service in Sonoma County. And so with a full service 211, there are more options to provide services and referrals and information to our residents. So Lisa spoke briefly about this 211, and I'm sorry that says 211 Sonoma. It should say 211 just 211, because we do 211 Sonoma and Mendocino, helps connect our community with information about health and human services available to them. It's accessible by phone by dialing 211. It's accessible by text message. And so if you don't have great phone service, or you just prefer not to directly talk to somebody on the phone, you can text your zip code to 898-211, and a live call specialist will text back and forth with you. So it is a true two-way text. And then we have our website as well that has a self-guided search and different categories that you can click on to search. And so there's various ways that we can access information through 211. And we always say that the information in 211 is only as good as, or the services through 211 is only as good as the information that we have. And so we work really hard to identify resources in the community and our community partners and form relationships with them so that we can have, two-way communications with those agencies to get resources updated when they add a program or when they stop delivering services. We do a biannual agency update where we ask all of the agencies in the database to take a look at their listing and let us know if anything has changed. For the first 16 months of COVID, we did monthly updates. So we sent monthly reminders out to our partners saying, take a look at your resource in your database. We know that things may have changed because of COVID, and update it, because we really want to be able to give accurate and timely information to our callers and texters and website users. So why is 211 important? One of the main reasons that it's important to us, and I talked about our values early on in the presentation, is that it promotes equity and financial stability. We really see 211 as an equitable avenue for people to access information because it is free, because it's available in so many languages, because you can access it however you feel comfortable, whether that's calling and talking to somebody or text messaging or looking up information on your own. It advances the social and economic mobility by connecting our clients and community members to resources available to them. We really strive to promote financial stability, and we know that if we get our community members tied into the services that they need and they're not food insecure anymore and they have somewhere that they can lay their head down comfortably at night, that they are going to be more financially stable. We also see it being important because we know that there's a lack of broadband internet in rural communities. And so, somebody may not be able to go to their computer and search for resources or spend the time, Googling things, and they can actually just pick up the phone and call somebody, and that person can help them through the situation that they're in. And also, while they're having those conversations, do a screening to see if there's any other additional resources that they may need. And then again, during times of disaster, it provides streamlined incident-specific emergency information. So we are tied in Sonoma County and working in Mendocino County to be tied into the public information officer system and to be a part of the EOC during a disaster, so that we have that up-to-date information that we can just roll out into our call center and on the messaging when people call and on our website. And then a little bit more about our role in disaster and emergency. Again, it provides information through phone, text, and web-based technologies. One of the important things is that we're not only getting information from our official county sources, but we can do some rumor control if people from the public are calling in and saying, hey, I heard that this place is evacuated, or I heard that this shelter is closed, or whatever it may be. We can relay that information back to our county partners and verify it, and then put out, some rumor control messages that no, that's not true, or yes, that is true. And so it's kind of this bi-directional information sharing that we have, which has been really great. And then another really important thing is that it provides information to our access and functional needs population. And we've been working really hard with our call center in conjunction with PG&E to identify organizations that are providing services that directly impact or benefit our access and functional needs population, and making a plan for how to best serve that community during times of disaster. So not only are we putting out information to the community about what's going on, we're also taking those steps to help the most vulnerable in our community access services and connect with the agencies that they need to before, during, and after a disaster. And so, we took over 211 Sonoma in July of 2019, and in October of 2019, Sonoma County suffered through the Kincaid fire. We had almost our entire county evacuated. And so we were really able to get our procedures down and our relationships built with the County of Sonoma to be able to provide this information. And we're, working on it with Mendocino County. And if 211 becomes a full service 211 under the operation of United Way for Lake County, we'll do the same in Lake County. And that ends kind of my formal presentation. Lisa, is there anything else that you wanted to add before?
I think maybe, Nicolette, let's invite, because this is an informational presentation, let's show the board members the website and invite them to explore that and take Q&A right now, and let Matthew facilitate that for us.
So as Lisa mentioned, I'll share my screen one more time. I'm going to show you the 211 Sonoma's website. And one of the features on this website that we are really proud of and think is a really beneficial resource for our community is the reporting function. So I'll show you that. I just also wanted to show you just the general website. 211 Lake does have a website like this right now. It is limited because of the disaster only component. So this is kind of what a full service 211 website would look like. We have a 211 spotlight where we can highlight some of the information that is most timely. So obviously right now that would be vaccine information, financial assistance, and COVID information. And then here are the different categories that you can search for resources. And then there's also a guided search where you can put in a keyword and search. But just for the sake of time, I'll go ahead and show you this reporting function. So we have an interactive report. And I'll just make this bigger. So you can pull up information on calls and it can be broken down by demographic, city, client language, age group, if they have children under 5, their ethnicity, whether they called or texted, and see how many phone calls we've taken in a certain period of time, how many were first-time callers. This right here is really the kind of bread and butter of this reporting function. So it'll show you categories of need. So it gives you a nice little snapshot of what people are calling about, what the need is in the community. And so we see right now that, housing is our #1 category of need, and then income assistance, food and meals, and healthcare. COVID related calls are all comprised in that healthcare category. And then within categories of need, you can click on the just housing, and it'll break down here what the subcategories are. So we see that rent payment assistance is our #1 category of need. Homeless shelter would be next. And again, you can filter this down by specific cities or specific, caller ethnicity or age. And so I think that it's a really great feature just to kind of have your finger on the pulse of what's going on in the community. We hear a lot of anecdotal information, and then this really puts that quantitative information down. And so I encourage you guys all to go to 211sonoma.org and just take a look at the reporting function. It's not available, unfortunately, for Lake County because of the disaster only. However, if we were to transition to a full service 211, after 6 months of calls, we would be able to report this data.
Well, thank you very much, Nicolette and Lisa, for your presentation this morning. I know our board members will be interested to know what are the typical costs associated with full 211 implementation, as well as you mentioned that you provide by contract some more intensive supports in the EOCs for some of our neighboring counties. Can you speak to the costs for those as well?
Yeah, so we've crunched the numbers for Lake County a bit and have kind of compared them to Mendocino County as it's more comparable than to Sonoma County. And it looks like for a 211 to run for a 1 year, it's between $180,000 and $200,000. And that's just for, regular call handling, website maintenance, resource database maintenance. And then as far as our contract with the county for disaster only services, we have an up to contract. And so basically it's an up to $50,000 at this point. And it really pays just for some of our United Way staff time and then a reimbursement for the calls at $10 per call.
Thank you very much. And now we can take some questions from the board.
All right. Thank you very much for the presentation. And yes, that's definitely an important factor when discussing this program as well, how much the actual cost will be, though that is just an estimate. Looking to see if we have any comments or questions. Supervisor Pyska.
So I really appreciate this presentation. I get asked about 211 a lot. We have a lot of seniors in our county who don't really have any other ways to access information. I actually got a really long call on Friday from a frustrated senior who asked that we put more prompts on all of our outgoing voicemails to have access for more information. And she had quite a few comments about everything from the museums to the bus routes to everything. So it is something that I've heard over the years, and we are living in these dynamic times where we're going from disaster to disaster or compounding disasters, rapidly changing information. So I think that this would be a really valuable program for our county. So we're currently paying up to $50,000 for the disaster only.
That's in Sonoma County. So the SB 1212 funding covers the cost of this disaster only 211 currently. The funding runs out, I believe, next June. And I'm not intimately knowledgeable about the SB 1212 program at this point because we're not.
So if we had full service, it would include disaster service.
If you had full service, it would be just the general contract for call handling, and then another contract for disaster activation.
So it would be potentially $200,000 for the full service, and then an additional up to $50,000 or something along those lines for a disaster.
Yeah, if there was a major declared disaster and 211 was activated to be the go-to number for folks in Lake County to call to get incident specific information. Yeah.
Okay. Thanks.
Any other questions or comments? So I'm interested in learning more. I think that it has potential. I'd like to find out some specific feedback from Sonoma County and from Mendocino County about their move from the disaster only 211 to a full-fledged service 211. What's been the overall impact for their community. I'd also love to find out what some of their outcomes are. I think it's great to show numbers that people reached out asking about housing or asking about healthcare, but did they actually find something that brought them to a better place, or did they just have a call in and received maybe some information but weren't able to actually get to a better place? And I think that the outcomes are going to be really important for me if we're looking at that amount of cost for the service. So I think those are two things that if this comes back to us, which I'm hoping it does, those are going to be important factors for spending that amount to make a change from what is already available to us when it comes to a disaster, which right now we're kind of taking advantage of the fact that the disaster has been quite a long-term disaster, but it also is not providing every little bit of information that the full service would provide either. So those are the things that I think will make an impact on a good decision for us to take. Before I open up for the public, any last comments? Supervisor Scott?
Just that I agree that we need to have some sort of service that our constituents can call to try to navigate the system. We have so many services out there, many nonprofits helping our community, but many don't know where to go to be able to seek those services. So I don't know if this is a platform we need to go with, but we definitely need to be looking at some sort of platform to help our community.
Supervisor Simon?
Yeah, I'd be willing, obviously, to hear some more about it. I appreciate the work that CEO Hutchinson and Matthew Rothstein has put together to bring this to us. But we are looking for some type of clearinghouse, like you say, how to navigate the system. We have other programs, hopefully, that we'll be bringing on board, through some of the, not really disaster services, but under the Risk Reduction Authority, where to go to get information, where the chipping services are happening, all kinds of other things that I could think that may be able to help in that area. But navigation, the system, it does come down to the two things that you've already talked about, Supervisor, about the one, cost, where these funds would be coming from, if there's an opportunity for grants or other things like that down the road to look at, but really what budget units would be doing. And then obviously the outcomes. It's a great thing to have where people can call and get the information, but you've already said it. What is the result? Are they getting put to the right areas, getting the services they need? And what type of support is that going to be from all of our departments as the calls are coming in? So looking at those costs, but obviously you think that, it works in other areas, but it really comes down to the return on investment for our constituents. So that's where I'm at, but I would like to hear more about it and continue the conversation.
Supervisor Pyska?
I think a really critical part of this presentation is that you mentioned you're going to be doing the updates on a consistent basis. And that's something that we all struggle with. If there's a website anywhere out there, it's almost immediately outdated. And so to have that included in the price of service is to know and we all have confidence that that's been being updated on a regular basis. That's really important. And that makes me feel really comfortable with a program like this.
And I do have one final comment. You mentioned the phone, the texting, and the website. You didn't mention social media. Do you also provide a social media platform where that information can be shared and provided to other groups? I know that happens kind of organically throughout every community. But I think having that available, the up-to-date data that might be posted on your social media site that might be shared by others can really proliferate the information quickly to the public. I know whenever there's a disaster, I think more people go to Facebook to look for what's happening rather than dialing 211. And granted, that's because we haven't really advertised the fact that people can really use 211. It's kind of new to us, the fact that we're using it. In the past, I want to say 6 months to a year is what we've been doing. But yeah, just was wondering if you have any social media presence so that our public can utilize that information to make sure and hand it out to the right people.
United Way of the Wine Country has an active Facebook and Instagram page, and we do use that to share information about 211. It's mainly guiding people saying, during a fire, you can dial 211 or text 898-211 to get up-to-date information. And then we also will occasionally share some of our community partners, resources if they have postings on Instagram or Facebook. And then we've worked really closely with the County of Sonoma to co-brand our social media posts during times of emergencies and disasters so that they're getting those up-to-date information co-branded with County of Sonoma and 211 to know that they can visit the website or call 211 for additional information.
Okay, thank you very much for that. If there's nothing further from board members, then let's go ahead and open it up to the public. We have a hand up in the Zoom room, Betsy Khan.
Betsy, you're muted right now.
There we go.
I'm trying. Thank you. Good morning. Thank you, Chair. Thank you, members of the board, and thank you to Lisa and Nicolette. Also, thank you, Supervisor Pyska, for being so clear about the issue for seniors. Facebook is great. I use Facebook all the time. Bruno is completely correct. It's instantly available to those of us with technology, but we have a very large population of people who do not have or use that technology. A lot of people, even if they have smartphones, don't use them for internet because of the cost of the programs. So being able to use this for the telephone, straight, simple, and promote it through social media and all those other things is absolutely wonderful. We spent hundreds of thousands of dollars already on putting together a database that's available from the Lake County Behavioral Health Services homepage, which you have to know how. First, you have to have technology to get to. Then you have to know to go there. Then you have to look for the link to the page. And then once you get to it, it's really cumbersome to use. Plus, the updating is crucial. Everybody knows this. Things constantly change. And I would like to, I'd be very curious as to whether you could provide us any information about how your services were provided to Lake County during the 2016 Clayton fire. We did not have the telephone systems geared to accept 211 calls, but you guys provided an 800 number that important that was to them in that period of time. Because there was no FEMA support, there was no state emergency support. It was strictly a local disaster response. And that was a huge benefit to us. So I really appreciate this. Thank you, Matthew. This is something so important. And I really urge the board to do whatever it takes to make this happen. Thank you very much.
Thank you very much. And did you want to speak on the activities that you took part in for Clayton Fire?
Well, just to be clear and to answer Betsy's question directly, United Way of the Wine Country became the administrator for 211 in the summer of 2019. We were not the administrator for 211 in 2016 during the Clayton Fire. So neither Nicolette nor I have any information about whether and how 211 was activated in Lake County during that fire. And I apologize for that, but we could see if we could track that information down. But as we speak today, we don't have that information.
Lake County did not have 211 prior to Sonoma County in 2019.
Thank you very much for that clarification. And I see no hands up in the board chambers and no further hands up in the Zoom room. And so bringing it back to the board, it seems to me that we have consensus that we would like to continue this conversation. I know that I've requested some more information specifically. Is there any other specifics that the board would like to pass on to Mr. Rothstein before we move on?
Just coming up with the numbers, what we're looking at, is it a phase situation that we're looking at, coming up with some potential direct funding proposals and working with Carol and the board on looking where that funding would come from for this operation. So that's my request, and it sounds like we've made that already, but just, that's clarification.
I appreciate the clarification. I think it's best to make sure they know exactly what we're looking for so that next time that information can be provided. And it sounds to me like that's it, or it looks to me like that's it. So again, thank you very much today for presenting to us and providing that service to our surrounding communities. And hopefully we'll see each other soon again, and we'll discuss about possibly working with you to help our community as well.
Thank you so much.